At the state level, to better support new moms and their families in the weeks and months after delivery, 1 in 7 moms will suffer postpartum depression, but finding and affording treatment can be incredibly difficult.
Our own Danielle Lerner recently opened up about her postpartum journey, and tonight she's digging into what's being done to help families access care.
And that's my son Lachlan through various ages.
Walk around Cindy Herrick's home and it's clear 7-year-old Lachlan is her pride and joy. But it didn't always feel that way.
I didn't feel any joy. I was terrified of my son.
Cindy had lived with depression and anxiety, took medication, but says the symptoms intensified during her second trimester and got terrifyingly worse after delivery.
We didn't really know who to go to for help and where to reach out to for help. And even when I did, people didn't know how to help me.
Her recovery took 3 years.
I remember telling myself that if I survived it and got out of it one day, that, I would do something to try and change it.
Cindy now works with the national organization 2020 Mom, advocating for better maternal mental health care across the country and working with lawmakers like State Senator Heather Carter here in Arizona.
How do you make treatment more affordable and more accessible, especially in traditionally underserved populations?
So we need to make sure that we are collecting data around the incidence of perinatal mood and anxiety disorder so that we can demonstrate that there is a need for services.
Carter has introduced several bills this legislative session. SB 1290 creates a maternal mental health advisory committee charged with finding and recommending better ways to screen and treat perinatal mood disorders by the end of 2021.
We will also be looking at expanding SOBRA benefits for new moms so that they can receive care beyond those initial first months postpartum.
SB 1392 would allocate $13 million to Access to extend those benefits for a year postpartum. And SB 1472 creates a provider incentive program to get more women on Access attending their 6-week postpartum doctor's visits. Right now, that rate is just 20%.
We have this perception of motherhood that it should be perfect.
Cindy agrees these are crucial steps forward, but says promoting a more realistic version of motherhood can also change lives.
I have yet to meet a mom who has had it all together, myself very much included, right? It's just, even if we don't have it all together, it's okay.
In Phoenix, Danielle Lerner, ABC 15, Arizona.
Tomorrow morning, Senator Carter and others will hold a press conference at the Capitol highlighting maternal mental health care in our state.
And we have a lot more information on what to watch for and local resources offering help. It's up right now on abc15.com/postpartum.